Dr. Chris Pernell joins us now, and NAACP Center for Health Equity, leading public health and preventive medicine expert and physician who's been on the show many times. So welcome back. This was an odd thing, but the background, been kind of a vaccine skeptic. In fact, there's a quote from his past, Weldon's past, when he says, when evaluating whether or not to vaccinate their children against influenza, parents should not be forced to choose between the risk of mercury-containing preservative thimerosal, whether perceived or real. So he said that kind of thing, but they pulled it. What do you make of it?
Well, it's a sigh of relief from a public health physician, from all of public health, and frankly, for the American public, that he will not be in the position to lead the CDC because of who is already leading HHS. Look, public health is under threat. Public health has been under threat since erosion in trust of public health during the pandemic, because political actors were, sending out misinformation or disinformation. And so we need to do whatever possible to safeguard the health and well-being, especially vulnerable groups.
So it's really interesting that you bring up COVID. I agree with you that had a big impact on how people perceive it. And people that are on this other side, maybe on the Bobby Kennedy side of it, I guess is the best way of saying it. They say that everything that they were saying during the pandemic was basically ignored, and some of it turned out to be right, that kind of thing. So Jillian Michaels, the fitness expert, was on the show earlier. She's from that camp. Here's what she said.
If you look at something like COVID, this was pushed through an emergency use protocol. It wasn't put through the necessary paces. When you speak to PhDs about it, which I have on my podcast, it's actually gene therapy and doesn't fit the traditional definition of a vaccine in any way, shape, or form. And kids are not prone to having very dangerous reactions to COVID. Again, this is the point of nuance.
So when she says nuance, she said she was supporting having people take the measles vaccine, which is what we're talking about, but she had questions that she says should be legitimate about the COVID vaccine. So, but to your earlier point, a lot of this came out of the pandemic.
Frankly, she's a fitness professional. She's not a physician or public health expert, and that's the danger. You have the conflation of people who, quote unquote, talk about wellness, talking about things that is rooted in science, and manipulating the information, if you will, so that we have florid misinformation and disinformation. It is not that the COVID vaccine was gene therapy, as much as the COVID vaccine was making use of an innovative technology. We have someone in Robert F. Kennedy Jr., who is a vaccine skeptic, already leading HHS, which is a threat to public health, which is a threat to clinical prevention. We have someone in the past Trump administration and being proliferated through this current administration, which questions public health science. So
what do you mean
today by not ensuring the nomination of Weldon?
What do you make about Kennedy, though, with the food stuff? Like, he was going after, he's meeting with the food companies. Is there any merit to that? I mean, he's just out with a new comment related to chemicals in our food, and he wants to push the FDA, he says, the FDA commissioner, to start the process of changing the rules, eliminate some of these chemicals. I mean, does he have some points on some of this, on some of that stuff from a health perspective, do you think?
Listen, prevention is important. And one of the things that we need to prevent is how the food system in the United States at times is not engineered or is not produced in the healthiest or the safest ways. That's a true point, but you cannot conflate one true point with a larger false point about vaccines and about public health science. So yes, those in public health will seek ways to ensure that where there are areas that HHS, under his leadership, are putting out worthwhile information, we will lean into that. But we also must drum the beat very loudly around accountability of all of public health, infectious disease, alongside chronic disease prevention, alongside food safety. It's not one or the other.
All right, Dr. Pernell, as always, thank you. Dr. Chris Pernell with us. Thanks so much for watching. Just go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.